Hello, my name is Barbara Ann Raymond Crucito. Today I'm going to be answering the alternate DFC final reflection interview questions. So I did my DFC rotation June 3rd, 4th, 6th, and 7th of 2024, and I completed this in New Smyrna Beach, Florida at Advent Health Hospital. The skills that I felt confident in performing during the DFC was being able to do full head-to-toe assessments, as well as being able to hang different IV medications and fluids such as normal saline and lactated ringers with supervision. It really gave me the ability to kind of familiarize myself with those medications and fluids. The skills that I feel like I could have performed better during the DFC was inserting IVs with supervision, because this tends to intimidate me and I'm not necessarily the most confident with that skill. So, being able to kind of work on perfecting that skill, so that way I can confidently go in and do so on patients during DFCs with supervision, of course. If I was to repeat the DFC rotation, I would have looked over my skills more and also studied the anatomy of the heart, to familiarize myself with like the pathophysiology, because I went into the cath lab and I was able to watch some stents getting placed, and so it would have been nice to be a little bit more familiar as to what exactly they were doing. So that's what I would probably do different. Participating in the DFC has increased my clinical nursing skills, because I was able to work on perfecting not perfecting patient safety, but making it my number one priority, and remembering that. I was able to do the 5 rights of medication administration to, again, make the patient safety my number one priority, as well as I was able to become more familiar with different medications and that sort of thing. A challenge that I had dealt with during the DFC was the nurse that I was with. We had a patient that was non-compliant, and so it kind of became a challenge because you want to do what's best for the patient, but they're not wanting that for themselves, so it becomes kind of difficult. So the underlying cause of the challenge was just a lack of education on the consequences of their non-compliance. So they knew what they had to do. It was just a matter of being educated on what the consequences were if they were non-compliant long term. So the challenge was resolved by educating the patient on the consequences of non-compliance, and we had used the teach-back method as well, to make sure that the patient is understanding what can happen if they do continue being non-compliant. Something that could have been improved to prevent similar patient challenges from happening in the future was ensuring that before discharge, potentially and throughout their hospital stay, making sure that the patient is educated on whatever it is that they are there for, as well as if there is non-compliance, or not even if there isn't non-compliance, but just stressing the importance of compliance. And they could also show compliance by, being willing to, give the medications themselves, whether that, like with you in the room, kind of handing it to them and getting them used to actually administering those themselves with you there in the room. This challenge impacted my confidence related to handling challenging situations in the clinical setting, because I was able to learn how to deal with non-compliant patients, and I was able to kind of understand the importance of stating those consequences of the non-compliance, even prior to the patient's discharge. making sure they understand not only what they have, but what will happen if they are non-compliant. The DFC was definitely valuable to improve my clinical skills. I was able to work on skills that I wasn't necessarily the most confident in. Like I said, with just like patient safety and the 5 rights, sometimes it can be, it kind of intimidated me with like all the different medications and trying to kind of get used to those. But I was able to get that confidence in administering those, medications and stuff in a safe manner. My attitude, approach, or efforts that helped me make my DFC rotation successful was having an open mind, and making sure that the people around you and the people you're working with know that you want to learn more, and also just like offering to help, and stating the skills that you have been checked off on, so that way they know what your abilities are. That seemed to kind of help me get the most out of this DFC rotation. The guidance I would give another learner to help prepare for and complete a DFC rotation would be ask questions. Ask them all. Anything you want to know, don't be afraid to ask them. Offer help in the clinical setting, as sometimes this staff didn't really know what, if we wanted to help or, whatever the situation may be. So just offering to help and letting them know your desire to learn, and stressing on like, hey, I really want to learn in this, in this setting. I want to be hands-on. And one suggestion to the faculty member, the college, or the facility would be just looking for different units for us to go into. All of my other DFCs, I wasn't really able to go anywhere other than like med surg, but at this one I was able to go in the cath lab. I was able to see quite a few things there, but it would have been nice to be able to get more experience in like ICU or going somewhere that has like mother and baby, pediatrics, that sort of thing, so that you could kind of expand your knowledge and become confident in more than just med surg. And so that's all I have for the DFC final reflection interview questions. Thank you.